store management and inventory control. In this class, we are going to explain about the hospital pharmacy, or also called as pharmacy practice. In this class, we are going to discuss about the drugstore management and inventory control. In this drugstore management, the first one is organization of drugstore. While we are taking a drugstore, it will be clean and site of selection, and it contains features of good layout design. The drugstore will be looking for the appearance, what is called as infrastructure of the drugstore will be perfect, and measuring layouts will be proper ventilation, which is having ground floor and proper roofs, and the drugstore having number of physicians and age group of the people in area, and these are the some most important organizations for the drugstore management. And in this drugstore management, the organization of drugstore will maybe having site of selection and a good layout design, and then the perpetual inventory control system, bin card. This is main thing. Bin card means this is the document which is maintained by the storekeeper to record the items of materials and goods. In this bin card, it contains the ready reference. It is also called as ready reference. In this bin card, each and every material will be noted in that bin card to marketing the drugs or also everything. Okay. And then store ladder, continuous stock taking. What are the advantages of the inventory control system? Let us know about the advantages of the perpetual inventory control system. In this inventory control system, the stock verification will be occurred. This stock verification will be performed year to year, and then it is helpful to formulating proper purchase policies, and every detailed drug details, everything will be noted in a bin card. Errors can be minimized by the use of bin card. So that is the one advantages of the inventory control system. And continuous stock verification and some corrections in the stock figures, it will be useful to the inventory control system. And storage conditions, the drugs can be stored at the cold area, like which is nothing but antibiotics, biological drugs, capsules, tablets, liquid dosage forms. These can be stored under the cold storage, and lock and key system will be used in this system. Here we have a doubt. What is the difference between cold storage and cool temperature? What is the cold temperature and cool temperature? Here we have to know that cold temperature means which is the 2 to 8 degrees. The temperature between 2 to 8 degrees is called as cold temperature, and cold temperature LD. Okay, and the temperature in between 8 to 25 degrees, it is called as cool temperature. Okay, the room temperature is preferable for that pharmacy drug area only, and that will be not exceed for the 40 degrees. Okay, excessive heat causes the degradation of the drugs, and it will be damage the drug property. So, and the store management, the storage We already studied that. Drugs can be stored at the cool temperature or a cold temperature. This is about the storage management. Let us move to the next subtopic, that is purchasing. What is the purchasing? Purchasing means this is a process which include all functions which involves the requirement, receipt of material and final acceptance. Means it means purchasing means the drugs can be purchased by the pharmacist from the wholesaler or retailer to in a bulk form. That is called purchasing. Uh, what is the definition? Perfect definition of the purchasing is procuring of materials such machine tools and service required for the equipment which is maintenance and operation for the manufacturing plant. This can be also defined as receive the drugs and storing, and then we have to purchasing that drugs for the pharmacy. In this purchasing, there are 5 principles are there. They are right source, right time, right price, right quality, right quantity. These 5 R's are useful for the purchasing process. Right quality. By the selection of right quality product, it gives good therapeutic values. And quantity also. The quantity of the drug will be differ for the person to person, means it means age to age, okay, like that. And right time means it means minimum level. The right time means the minimum level. This level indicates stock which reached to the minimum and now order must be placed. It means any delay is happened, the production will be lost. So that's why right time will be, time is a very important key in the purchasing. And right source, we are purchasing the products or like drugs, the source will be correct. And right price, these are the 5 principles of purchasing. And procedure, purchasing procedure. In this purchasing procedure, there are 7 steps are there. They are requisition. First we have to order the things. We have to list out the drugs names with their quantities, and then we have to to tell to them, means retailers. That is called as purchase requisition. And then selection of suppliers. After that, selection of the items. Afterwards, they will offer some drugs like new drugs. Then we have to select some good quality drugs. After that, placing the order. Placing the order also a major role in this process. And receiving and checking the material. After placing the order, the material can be received, and then we have to check the material. If there is any breakage in that products, we have to give them back. And checking the bill checking, it is most important thing. By the checking bills and recording the bills in book, it is a major role, because we have to record write everything, every bills and every in a book. We have to already discuss about that bin card. In that bin card, we have to record the bills and their according that. First of all, paracetamol, how many tablets, these types of tablets, this much of quantity, and price is 1000 rupees. Likewise, this recording, checking of the bills and recording the bills in books. This is the procedure. And after that, these are the main procedures for the purchase. After inventory control. Next topic is inventory control. In this inventory control means the amount of material or resource on the hand. It includes raw material, work in process or finished goods and store and spaces. This inventory control is a process which measured and regulated according to the predetermined norms. The inventory control pertains certain administration of the established policies, systems and procedures to order the inventory cost. This is the inventory control. What is the inventory control process means? The process which inventory is measured and regulated according to the predetermined norms such as economic lot size for the order, and the safety stock, minimum level, maximum level and order level. This is about the inventory control definition. Here some types of inventory control are there. They are raw materials, work in progress, ready-made compounds, scraps, finished goods. These are the 5 types of inventory. What is main objective of this inventory control? To meet unforeseen future demand due to variation in forecast figures and actual figures, to smoothen the production process, to gain economy of production. This is the main motto of the inventory control. To meet the time lag for the transportation of the goods. This is also one kind of motto or objective for the inventory control. What are the factors affecting inventory control? Here 3 types of factors which affect the inventory control. They are type of product, type of manufacture and volume of production. Types of inventory costs. Before we are going to discuss about the types of inventory cost. We already discussed about the types of inventory. The types of inventory and the types of inventory cost, these both are different, okay? And here types of inventory cost: ordering cost, inventory carrying cost and out of stock cost, other costs. These are the 4 types of costs. And classification of inventory control, we already discussed the types. Now we are going to discuss about the classification of the inventory control. They are ABC analysis, VED analysis, EOQ analysis. ABC analysis means always better control. VED means vital, essential, desirable classification. Analysis. Vital, efficiency, desirable analysis. EOQ means economic, order, quantity, method. These are the 3 types of classifications which include in the inventory control. This is about the drugstore management and inventory control. Thanks for listening.